Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Study shares new insights into Alzheimer's disease. The team of investigators, led by Professor Ben Gold at the University of Liverpool, have examined the role of two proteins found in the brain and suggest the stability of their relationship to one another is crucial for memory formation and maintenance. The new study represents a significant step forward in scientists' understanding of Alzheimer's disease. Researchers have shed light on how mechanical signaling in the brain is disrupted and could lead to the condition which accounts for 60 to 80% of dementia cases worldwide. Disruptions in this mechanical signaling pathway could lead to the disease. The study proposes that amyloid precursor protein, known for its role in the formation of the amyloid plaques in the brain that are a characteristic feature in Alzheimer's disease, directly interacts with tallin, a synaptic scaffold protein. Can intestinal infections affect bile composition? Intestinal infections can change the composition of liver bile, leading to changes in immune function and gut bacteria, potentially helping fight off harmful bacteria. Researchers have identified a new axis of host defense by studying what happens during enteric infection, a term that encompasses all types of intestinal infections, including so-called stomach flu. A new study from infectious disease investigators at Brigham and Women's Hospital, a founding member of the Mass General Brigham healthcare system, uncovers how bile, a solution produced by the liver and responsible for the absorption of fat, plays a role in the fight against infections. Results are published in Nature Microbiology. The changes we detected in the composition of bile with infection are beneficial for the intestine to clear infection, said Matthew Waldor, MD, PhD of the Brigham's Division of Infectious Diseases. New report highlights need for sustained investment in infection prevention and control programs. Nearly 5 years since COVID-19 was first reported, a new global report on infection prevention and control by the World Health Organization shows there has been slow progress in addressing critical gaps to prevent healthcare-associated infections. A large proportion of healthcare-associated infections can be prevented with improved infection prevention and control practices and basic water, sanitation and hygiene services, which are also a highly cost-effective best buy to reduce antimicrobial resistance in healthcare settings. This report, launched at a G7 side event hosted by Italy, provides a baseline assessment for policymakers, infection prevention and control professionals, healthcare workers and stakeholders to guide action. The report finds that though 71% of countries now have an active infection prevention and control program, just 6% met all of the WHO infection prevention and control minimum requirements in 2023 and 2024. This is well behind the target of more than 90% by 2030 set in the WHO Global Action Plan and Monitoring Framework on Infection Prevention and Control. The report also highlights that patients in low and middle income countries have up to 20 times higher risk of acquiring infections during healthcare delivery than in high-income countries. The COVID-19 pandemic, along with outbreaks of Ebola, Marburg and Mpox, are the most dramatic demonstrations of how pathogens can spread rapidly and be amplified in healthcare settings. These healthcare-associated infections are a daily threat in every hospital and clinic, not only during epidemics and pandemics, said WHO Director General Dr. Tedros Adhanom Ghebreyesus. Every country can and must do more to prevent infections in healthcare facilities and control them when they strike. Type of delivery method may be associated with child undernutrition and mortality. Data from the National Family Health Survey in India indicate higher risk of stunting, wasting and underweight among children born via C-section compared to those delivered vaginally. The analysis, which included 2,794 births, also found an increased likelihood of neonatal in C-section births. Additionally, children born to mothers with third or higher order pregnancies faced greater risk of both neonatal and infant mortality. These findings, published in BMC Pediatrics, highlight the need to address delivery methods and maternal factors in improving child health outcomes. Researchers from Fakir Mohan University, Balasore, Odisha, India, examined the impact of delivery methods on child health in children aged 0 to 59 months in India. For this purpose, the researchers used 2,794 samples in the study. Of these, 45,784 births were delivered by C-section, while the remaining 1,50,010 were delivered through normal vaginal delivery. To assess the association between child health and mode of delivery, life table estimation of mortality and bivariate and multivariate logistic regression were applied to data from the 5th round of National Family Health Survey conducted in 2019 to 2021. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.